As we all know, as age increases, there will be various changes that will occur in our body. One of the changes includes mobility and safety. Upon aging, the changes in mobility usually results from multiple impairments. This includes the central nervous system, muscles, joints, energy, and sensory physiological system. Due to multiple impairments that occur in elderly, this will gradually lead to, first, a slower walking speed. We can see how mostly elderly tend to walk slower as they age. Second, it will affect the performance on their physical function and well-being in doing their activity of daily living. For example, elderly will take time to stand up after sitting down. This shows a limitation in their ability to mobilize and ambulate. Third, a weaker movement and balance. This includes losing balance, especially when walking, and requires guidance when mobilizing.
Declining mobility and safety in the elderly may lead to problems such as higher fall risk. Higher fall risk may induce further complications such as disability and also hospitalization. Conditions such as disability and hospitalization will reduce the quality of life of an elderly, as most of the common routine or activity cannot be performed in the same way like when they are still well. Due to the reduction in functionality, the elderly will be affected not only physically but also emotionally and mentally. They will have low self-esteem due to the alteration in body image, and they will feel like they are troubling their caretakers.
There are many nursing care that can be given to the elderly patients related to mobility and safety. First, the nurse can perform assessment for risk for fall. For example, they can interview the patient for history of falls and assess their functional ability. They also can review the medication and medical history. This is to identify any medication that may cause drowsiness to the patient, which can cause them to fall, especially when they are mobilized without any supervision or assistance. The nurse also can perform gait assessments such as Morse fall scale. This is to evaluate the patient's mobility, toileting, fall history, and also the use of psychoactive medications. Any score under 25 points is considered as low risk of falling, while 25 to 45 points is considered to be at moderate risk, and more than 45 points is considered to be at high risk of falling. Next, provide exercise or physical therapy to the elderly. This is to improve their balance, gait, and muscle strength to maintain mobility. Then, provide the patients with working aids or glasses if required to ensure the safety while ambulating. Besides, the nurse also can encourage the elderly to use non-slip footwear to prevent them from falling while walking. Modification of home environment also can be done by eliminating barriers that can affect ambulation, such as small furnitures. Lastly, the nurse also can provide supplement as prescribed by the doctors, such as vitamin D. This is beneficial, especially to the elderly patients with vitamin D deficiency and has high risk of fall, as it helps to increase muscle strength, improve body sway, and decrease parathyroid hormone secretion and bone resorption.